Your surgeon says you need the surgery. Insurance will cover it. The hospital's already scheduling the date. You trust your doctor, so you say yes. But here's the brutal truth. 5 surgeries that doctors routinely push on seniors over 65 have such terrible outcomes that I would never recommend them to anyone I care about. And by the time you realize the surgery destroyed your quality of life, there's no going back. But hold on. If you're over 65, or you've got aging parents making medical decisions right now, and you actually want to protect them from unnecessary surgeries that do more harm than good, hit that subscribe button right now. I'm Dr. Martin Hale, and I don't play games with the medical establishment. I tell you the real truth about what happens behind those operating room doors. New video every week. Turn on notifications. All right, let's get into it. All right, here we go. Surgery number 1 that I would never recommend to a senior over 65, spinal fusion for lower back pain. Now, I know your back hurts. I get it. You've been dealing with it for years. You've tried physical therapy, you've tried injections, you've popped ibuprofen like candy. And then your orthopedic surgeon says, you know what? Let's just fuse those vertebrae together. Problem solved. No. Problem not solved. Problem made 10 times worse. Here's the deal. Spinal fusion is when surgeons take 2 or more vertebrae in your spine and literally bolt them together with metal rods and screws. The idea is to stop the movement that's causing pain. Sounds logical, right? Wrong. Because here's what actually happens. Yes, they fuse those vertebrae. But now, the vertebrae above and below the fusion have to pick up the slack. They start moving more than they're supposed to, and within a few years, those vertebrae degenerate too. You end up needing another fusion, and another. It's a goddamn assembly line. The success rate is terrible. Studies show that for chronic lower back pain, not spinal instability, not fractures, just regular degenerative back pain, spinal fusion has about a 50–60% satisfaction rate. That means 40–50% of patients say the surgery didn't help or made things worse, and seniors have even worse outcomes. Why? Because your bones are weaker, your healing is slower, your risk of complications is higher. Seniors don't know this. Most American seniors think, well, if the surgeon says I need it, I must need it. They don't realize that a lot of spine surgeons are incentivized to operate. Spinal fusion is a $50,000 to $100,000 surgery. Hospitals make bank. Surgeons make bank. Medical device companies make bank. But you're the one who ends up with chronic pain, hardware failure, infection, and a body that doesn't move right anymore. Real-world example. I had a patient, Richard, 68, from Houston. Had lower back pain for years. Went to a spine surgeon who recommended a 2-level lumbar fusion. Richard trusted him, went through with it. 6 months later, the pain was just as bad, plus now he couldn't bend over to tie his shoes. He was miserable. We sent him to a different specialist who said, you never needed that fusion in the first place. Richard could have managed his pain with targeted physical therapy, weight loss, and maybe some targeted injections. But instead, he's got metal rods in his back for the rest of his life. What to do instead? Exhaust every non-surgical option first. Physical therapy with a spine specialist, not just generic PT. Core strengthening exercises, weight loss if needed, epidural steroid injections, radiofrequency ablation, burns the nerve causing pain. Pain management with safer medications. Only consider spinal fusion if you have actual spinal instability, a fracture or severe nerve compression that's causing loss of function, not just pain. Actual structural problems. Bottom line, if your only symptom is pain and your spine isn't unstable, do not let anyone fuse your spine. I don't care how convincing the surgeon is. Surgery number 2, knee replacement for mild to moderate arthritis. Now, let me be clear. If your knee is bone on bone, you can barely walk, you've got severe deformity, and nothing else has worked, then, yeah, a knee replacement might make sense. But here's the problem. Surgeons are pushing knee replacements on seniors with mild to moderate arthritis who could manage just fine without surgery. The recovery is brutal. Knee replacement is major surgery. They saw off the end of your femur and your tibia, They hammer in metal and plastic components, and then you wake up in agony. The recovery takes months. Physical therapy is painful as hell, and about 20–30% of patients are never satisfied with the results. Why? Because knee replacements don't feel like normal knees. They're stiff. They click. They ache in cold weather. You can't kneel. You can't squat all the way down. And for a lot of seniors, the before-surgery knee actually felt better than the after-surgery knee. Complications in seniors: blood clots, infections, anesthesia complications, heart problems, prolonged hospital stays, rehab facilities. For someone over 65, especially if you've got other health issues like diabetes or heart disease, the risk goes way up. And here's the kicker. Once you get a knee replacement, it's not forever. Those implants wear out. The average knee replacement lasts 15–20 years. If you get one at 65, you might need a revision surgery at 80, and revision surgeries are way harder and way riskier than the first one. Seniors don't know this. You go to an orthopedic surgeon complaining about knee pain. They take an x-ray, see some arthritis, and say, "Yep, time for a knee replacement." They don't tell you that you could probably manage with physical therapy to strengthen the muscles around the knee, weight loss. Every pound you lose takes 4 pounds of pressure off your knee. Injections like cortisone or hyaluronic acid, a good knee brace, activity modification, but those options don't make the surgeon $20,000. Surgery does. Real-world example. Patient of mine, Donna, 66, from Tampa. Had some knee arthritis. Not terrible, but it bothered her. Surgeon told her, "Let's just get you a new knee." She went through with it. Recovery was hell. 6 months later, she was walking, but the knee never felt right. She told me, "Doc, I wish I'd just stuck with physical therapy and lost some weight. This wasn't worth it." What to do instead? Try everything else first. Lose weight if you're overweight. Physical therapy focused on quad and hamstring strengthening cortisone injections, hyaluronic acid injections, gel shots, NSAIDs, or acetaminophen, carefully, walking aids like a cane to offload the knee. Low-impact exercises like swimming or cycling only get a knee replacement when you absolutely can't function anymore, when you've tried everything else and your quality of life is in the toilet, not when a surgeon tells you it's time. Surgery number 3, prostate surgery, specifically TURP, transurethral resection of the prostate, for benign prostate enlargement. Guys, listen up. As you get older, your prostate gets bigger. It's called benign prostatic hyperplasia, or BPH. It's not cancer. It's just your prostate squeezing your urethra and making it hard to pee. Now, TURP is a surgery where they stick a scope up your penis, shave away part of your prostate, and hopefully improve your urine flow. Sounds great, right? Except the complication rate is brutal. The complications: retrograde ejaculation. Semen goes backward into your bladder instead of out. Affects 65–75% of men. Erectile dysfunction. Happens in 5–10% of cases, higher in older men. Urinary incontinence. You might leak urine. Bleeding that requires blood transfusions, infection scar tissue that makes things worse, and for a lot of men, the symptoms come back within 5–10 years anyway. So you went through all that for temporary relief. Seniors don't know this. Your urologist says, "You've got BPH. Let's do a TURP." You think it's the only option. But there are medications that work really well for BPH. Alpha blockers like Flomax relaxes the bladder neck. 5-alpha reductase inhibitors like finasteride shrinks the prostate. Combination therapy. There are also newer, less invasive procedures like Urolift, tiny implants that hold the prostate open, or Resume, steam therapy. These have way fewer sexual side effects than TURP. Real-world example. Patient of mine, Carl, 70, from Phoenix. Trouble peeing, getting up 4 times a night. Urologist recommended TURP. Carl asked me first. I said, "Let's try medication." We started him on Flomax and finasteride. Within a month, he was peeing better, sleeping through the night. No surgery needed. What to do instead? Start with medication. If meds don't work, try the newer minimally invasive options like Urolift or Resume. Save TERP as an absolute last resort. And if you do need surgery, make sure you understand the sexual side effects. Don't let a urologist brush that off. Surgery number 4, gallbladder removal, cholecystectomy, for mild occasional symptoms. Now, if you've got acute cholecystitis, that's a severely infected, inflamed gallbladder, then yeah, it's got to come out. That's an emergency, but a lot of surgeons are taking out gallbladders for vague symptoms like occasional bloating, mild upper abdominal discomfort, or gallstones that aren't even causing problems. Here's the problem. Once your gallbladder is out, it's out forever. You lose the organ that stores and concentrates bile. Now bile just drips constantly into your intestines. And for a lot of people, that causes chronic diarrhea, bloating, and digestive issues for the rest of their lives. It's called post-cholecystectomy syndrome. About 10 to 15% of people who get their gallbladder removed end up with ongoing digestive problems. Seniors don't know this. You go to the ER with some belly pain. They do an ultrasound, find gallstones, and the surgeon says, "Let's just take it out." You think, well, if there are stones, it's gotta go. But gallstones are incredibly common. About 25% of women and 10% of men over 60 have gallstones. Most of them never cause symptoms. They just sit there quietly for life. What to do instead? If your gallstones aren't causing symptoms, leave them alone. Monitor them. If you have occasional mild symptoms, try dietary changes. Avoid fatty, greasy foods. Eat smaller, more frequent meals. Maintain a healthy weight. Only remove the gallbladder if you have recurrent, severe gallbladder attacks, acute infection, blocked bile duct, pancreatitis from gallstones. Don't let a surgeon take out an organ just because stones showed up on an ultrasound. Surgery number 5, cataract surgery done too early. Now, cataracts are super common in seniors. Your lens gets cloudy, your vision gets blurry. Eventually, yeah, you'll probably need cataract surgery, and when done at the right time, it's one of the safest, most successful surgeries out there. But here's the problem. Ophthalmologists are pushing cataract surgery earlier and earlier, even when your vision is still pretty good. Why it's a problem? Cataract surgery is generally safe, but it's not risk-free. Complications include infection, endophthalmitis, rare but can cause blindness, retinal detachment, posterior capsule opacification, clouding behind the new lens, incorrect lens power, you still need glasses, and once you get the surgery, there's no going back. Your natural lens is gone forever. Seniors don't know this. You go for an eye exam. The ophthalmologist says, "You've got cataracts. Let's schedule surgery." You think cataracts sham surgery, but cataracts develop slowly. If your vision is still good enough to drive, read, and do daily activities safely, there's no rush. What to do instead? Wait until the cataracts actually interfere with your quality of life. Can't read, can't drive safely, can't see faces clearly, then it's time. But if you can still function fine with glasses, hold off. There's no benefit to rushing into surgery. Okay, so what do you do if a surgeon is recommending one of these procedures? First, get a second opinion, always. And make sure it's from a different hospital system, not the surgeon's buddy down the hall. Second, ask these questions. What happens if I don't have this surgery? What are all my non-surgical options? What's the success rate for someone my age? What are the complication rates? How many of these surgeries have you done? Third, do your own research. Look up the surgery. Read about complications. Join online forums and see what real patients are saying. Fourth, consider your overall health. If you've got heart disease, diabetes, lung problems, you're at higher risk for surgical complications. Sometimes the surgery is riskier than the problem it's fixing. Fifth, trust your gut. If something feels wrong, if you're being rushed, if the surgeon is dismissive of your questions, walk away. All right, folks, let's wrap this up. Here's the bottom line. American medicine loves surgery. Surgeons are trained to cut. Hospitals make money when operating rooms are full. and Medicare pays for it all, so there's zero incentive to pump the brakes. But just because a surgery is available doesn't mean you need it. Spinal fusion for back pain? Usually unnecessary. Knee replacement for mild arthritis? Try everything else first. Prostate surgery for BPH? Start with meds. Gallbladder removal for mild symptoms? Monitor it. Cataract surgery too early? Wait until you actually need it. I would never recommend these surgeries to my own parents unless they were absolutely necessary, and you shouldn't accept them blindly either. So here's what I need you to do. First, subscribe and hit that bell. I'm not here to make surgeons happy. I'm here to keep you out of the operating room unless you truly need to be there. Second, share this video with every senior you know. Someone's getting talked into an unnecessary surgery right now. You could save them. Third, leave a comment. Have you had one of these surgeries? Do you regret it? What was your experience? I read every comment. And finally, ask questions. Push back. Get second opinions. Don't let anyone cut you open without exhausting every other option first. Your body doesn't get a do-over. Protect it. Until next time, this is Dr. Martin Hale reminding you, question everything, especially when someone's holding a scalpel. Your life depends on it.